Hi, my beautiful people. This is Spill With Me, Jenny D. Thank you so much for tuning in. I am so excited. I've been wanting to do this for so long. I'm giving you a real big hug right now. I don't know if you can feel it, but I'm giving you this big hug because I feel like everybody needs a hug or a hey, you're doing great, or you look nice, or just compliment each other. I felt like I needed to start this because I've been running into so many people that just want to talk about their life experiences, their relationships, or like any story they needed to share. This could be something magical or something they wanted to share, but they're afraid of what others would think, me included. Or if you're hurting inside or have a funny story about life lessons you'd like to talk about, I would love for you to reach out. This could be the worst or your best times. Oh, and listen, I have some good topics. We're going to have a lot of fun because I believe the best medicine is to talk about it because someone else is dealing with the same shit. Hi, my beautiful people. So this week on Spill With Me, Jenny D, I am actually talking to a plastic surgeon.
Yes.
Dun, 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 dun. So for further ado, let's introduce Dr. Craig Oser.
Hi, everybody, and thanks for having me on today. Yes, it's correct. I am a board-certified plastic surgeon here in the Pittsburgh area. My office is located up in the Robinson area. And
How long have you been there?
I've been there probably about a year and a half. I just relocated there from another location also in the Robinson vicinity. So I've been serving that community now probably for a good decade plus.
Okay, so you've been doing plastic surgery for how long now?
I've been operating now for over 20 years.
Wow.
Yeah.
You look like you're 20.
Yeah, Botox works. So I'm full disclosure. I use Botox on myself.
So do I.
Yes. So,
Well, yeah. Why do you think it's that a lot of people want to do plastic surgery more than it's ever been?
well, I think nowadays with social media the way it is, with the television shows, and it's becoming a lot more mainstream. The other thing is I tell everyone that plastic surgery really predominates on the coast. So you'll see a lot of it introduced into the California area, Miami area, New York area, and then it kind of fizzles out through the rest of the country. And then Pittsburgh is a little bit behind. When I first came to the area in 2009 to now, it's definitely becoming more mainstream plastic surgery.
Right.
And I think all of those things together just have helped. The other thing I think is with COVID, the way it was, patients were doing a lot of these Zoom calls, looking at themselves in the computer, not happy with what they saw. So then we really saw a big uptick in neck liposuctioning, eyelid surgery, and facelifts because of that.
Oh, really?
As well as injectables. People were coming in and saying, hey, I need Botox, I need fillers because I'm on these Zoom meetings. I don't like the way I look.
Right.
So I think all of those things combined is what really caused plastic surgery to increase.
What is that show, Real Housewives of...
Well, whatever city you pick up, there's multiple ones out, and I think they're continuing. So.
And, I used to be that person that used to judge people and say, oh, they got plastic surgery, or look at them. You can tell that those boobs aren't real. And I'm like, who am I to do that? And I think that, maybe in my younger years, now that I'm 50, did I just say 50?
I didn't hear anything.
That I felt like, wait, what am I saying? I would love to improve the way I look. It's because what do you think it brings to a lot of your patients once they get it done?
Well, I think, the real reason, in my opinion, the right reason to have plastic surgery is because it makes you feel better about yourself.
Right.
Not for anyone else. One component of plastic surgery is the aesthetic space. The other space is reconstruction. So I do also have a component of my practice where I do reconstruction, such as breast cancer, skin cancer reconstruction, even trauma. So someone, God forbid, gets in a motor vehicle accident, a slip and fall accident, or a little kid bumps and splits their forehead open. The ER will call me and I'll take care of them for that. So plastic surgery encompasses that, where we kind of try and restore the patients back to their normal state if a trauma occurred. The other phase of plastic surgery, like you alluded to, is just the cosmetic space.
Right.
Where if you want to improve anything on your body, whether it's the face, the body, the breasts, we can do it. And nowadays, I'm doing a lot of what we call post-bariatric body contouring procedures.
What does that mean?
Yeah, so that's for patients out there that have lost extreme weight loss.
Oh, and they have the saggy skin?
Exactly.
Oh,
So,
okay.
when we talk about someone that lost 100, 200, 300 pounds, I had one gentleman went from 515 pounds all the way down to 180 pounds.
You're kidding me.
No. So we had to stage this gentleman where we did a couple tummy tucks because when he lost 200 pounds, the skin was hanging. He was riddled with a bunch of rashes and open sores. So then I had to take him to the operating room, remove that skin. Then he continued to lose weight afterwards. So that's
Right.
another big component of what we do as well.
That's unbelievable. I mean,
Yeah.
just to see the transformation of that, because really is that like just skin that's just hanging? It's nothing like a muscle or anything.
No, and unfortunately, it's nothing they can do in the gym to improve it. It's just that
Right.
redundant skin. They've lost the elasticity that a lot of us still have.
Right.
And when you lose that kind of weight, the skin just hangs from everywhere. So typically, someone will come to me, and I usually tell them, we start with the basic question: what bothers you the most? And if
Right.
it's their tummy, we start with the tummy talk. If we then may move on to doing a thigh lift, we may move on to doing arm lift or breast augmentation.
I didn't
with
even
the
know
lift.
you could do thigh lifts.
Oh yeah, that's for patients. Same scenario where someone loses a lot of weight,
Yeah.
or maybe they didn't lose a lot of weight. Just part of the natural aging process. We all lose elasticity, and if you have some lax skin in the inner thigh area, there are different type of thigh lifts we can do to address that. And we can also, in the right patient, maybe just get away with liposuction. We may not have to do a
Right.
surgical scar. So
Now,
it just
does this
depends.
hurt? Like liposuction, does that hurt?
It depends what part of the body. Liposuction, what I tell my patients, kind of feels like if you hadn't worked out in a long time and you did like a really rough workout and the next day you wake up and you just kind of feel black and blue everywhere.
Right.
That's kind of what liposuction feels like.
Okay.
Now, I'm known for going a little bit more aggressive with my liposuction, especially when I do my body contouring procedures, because I do feel like people are coming in because they want to see that result.
Exactly.
And that's the way I can give it to them.
So once they come in and they get the tummy tuck or the neck or the face, how many days does it, like, are you swollen? Like, does it take a couple of days, weeks?
Yeah, it depends on the procedure. When we talk about like a tummy tuck, for instance, and there are multiple types. We can get into that later. But a tummy tuck, I normally tell patients for the first 1 to 2 weeks, you're going to feel like you've been through a little bit of a rough workout.
Right.
But I usually put them on a restricted weightlifting for about a month. So for 1 month, I tell everyone nothing more than 15 pounds I want you lifting. After the 1 month mark, then we have you start to get back into the gym, start to exercise again, and then slowly progress from there.
Okay.
So that's kind of my tip. Now, if you're talking maybe a facelift, for instance, I tell patients to have a facelift, 2 weeks downtime. We have to wear compression. We give you like a head wrap to wear, and that's it. But a facelift really isn't that painful in comparison to a tummy tuck. Because whenever I do a tummy tuck, I also like to do a muscle
You're
tightening.
in the muscles, right.
Correct. So the
Okay.
muscles does add another degree of recovery that you don't have with, let's say, a facelift. So when I do a tummy tuck, there are things we can do also to dampen the pain. We have these long-acting shots that we inject right into the muscle. It lasts about 72 hours to give them the relief that they
relief,
need.
yes.
Because it's very important after a tummy tuck to get up and move around as quick as possible. So I have them up and moving the very next day. They can do stairs and everything.
Oh, wow.
Yeah, as long as they're just not lifting anything heavy, we're good.
Do these procedures take a long time? I know they're all different.
Yeah, it kind of depends. Like when I do some more of these bigger body contouring procedures, I could be in the operating room table with one of these patients 4 or 5 hours doing a tummy
Right.
tuck. A thinner patient that maybe have had like one child and
Oh, yes. I was going to ask you
Yeah.
about that because, with women having children and having that
Mm-hmm.
that skin that just won't go away.
yeah, and that's really the number one reason I see women coming
know
in.
it, yeah.
They're done having kids. They want their pre-mommy body back
Right, we
again.
want to wear a bikini.
Yeah, sure. So like, there are things that we can do. In some patients, we may be able to get away with just liposuction. Again, if that skin is hanging, then we do have to take out the skin. And also, whenever I do a tummy tuck, I always do what's called a muscle repair. Some people call it a diastasis recti, where the muscles actually separate from the pregnancy.
Oh.
Same thing happens when you gain a lot of weight and lose a lot of weight. The muscle separates, and that also cannot be fixed in the gym.
Okay, that's why I don't
No.
have that six-pack or whatever.
Yes.
That's what happened to me.
Well, give me a couple hours. I'll have you having it. It's not a problem.
I know that's the thing. I think a lot of I'm not speaking for everyone else, but I know
Right.
for me that I was always nervous. I'm going to be that person. I'm going to go in there and I'm going to have like one eye up here, the eyebrow
Right.
up here, the other one down here, and I'm going to look distorted. That's the
Right.
biggest thing that I was always fearful.
Yeah, no, I totally get that. And like you brought up face, whenever I'm evaluating someone for like a facelift, that's something they always say to me. I don't want the mouth to look stretched. I don't want to be pulled too tight.
Right.
I always pride myself on giving a very natural look. The best compliment I tell my patients they can get is if they bump into a friend of theirs they hadn't seen in like 5 years, and they're like, "Man, you look really good. What'd you do?" And they can't figure it out.
Yes.
So there are certain things that I feel that I do that maybe other docs don't do. Like when I'm doing a facelift, we like to make sure that incision is hidden within the hairline. So I shave a little bit of the hair around the sideburn area before I even get started, and that's why I place the incision so the hair goes right through it.
Oh yeah, tell me a little bit about that. What do you like?
Yeah.
So you have an incision. So when you're doing a facelift, I just think I don't even know what movie that was. Wasn't there a movie called Face Off?
There
John
was
Travolta.
with John Travolta where he wanted to change his appearance, and I
Yes.
think they swapped faces with him.
I don't
and
know
someone else.
how they did that, but
Yeah.
anyway, can you explain to us like
Sure.
what exactly where is it where you do the incisions?
Well, let me back up because when we talk about a facelift, like
Right.
there is a full facelift, there's a mini facelift, and so the question is like who needs what? How do you evaluate that? So the quick answer is the difference between a full facelift and a mini facelift is the neck. So if I have a younger patient, maybe late 30s to 50, that comes in, it's like, hey, my neck's not too bad, but I don't like these jowls. I don't like the hollowing I'm seeing in the cheek area, and my cheekbones, I feel like aren't as full as they once were. That patient, we can get away with what we call a short scar facelift. So we start out with an incision up in the sideburn area.
Okay.
I like to extend it on the inside of the ear, so I hide it on the inside of the ear, and then I wrap right around the earlobe, and that's it. So that's the length of the incision in a mini facelift. That differs from a full facelift where we're doing the neck, where I have to extend that incision behind the ear in the natural crease up into the hairline behind the ear as well. And we have to pull all that neck skin behind the ear and cut away the excess tissue.
Oh my gosh, I'm just thinking about it. I mean, of course they're not awake.
Oh, no. I actually do mine under what we call twilight sedation. So twilight sedation means that there's an IV in, they're giving you medication, there's no tube in your mouth.
Oh,
So
okay.
patients don't realize that. They're still breathing on their own.
Yes.
Now, we just started doing this new type of facelift for the right candidate. And basically all I do is I make a little incision around the earlobe, and that's it. And we can tighten up that jawline area for the patient
Right.
in conjunction with a little bit of what we call submental liposuction. So I liposuction the neck. We take a little piece of skin out right around the earlobe, and that really is for that patient that's in their 30s, maybe early 40s that are
Right.
just starting to see the signs of aging. They're not candidates for a full
Right.
facelift, but they want to improve it somehow. And then, we also do other things in conjunction with that. If someone lost volume, I can do a fat transfer. So fat transfers have been pretty popular these days, and I do fat transfers all over the body. Fat transfer to the breast, to the butt, which we call Brazilian butt
I
lift.
need the butt.
The butt. All right. Well, we'll do a fat
They
transfer
have
for
jeans
you.
out there and I said these don't work.
Yeah, those apple bottom jeans. Right. That's where the song came from.
Yeah, right.
But yeah, so we will liposuction. Like I did a case today. I did someone's lower eyelids, and I liposuction a little bit of fat out of her abdomen, and we injected it into the face to restore volume there.
Oh my gosh.
And I make
fascinating.
Yeah, it's pretty amazing. So what is the reason to do that? Well, patients that are getting fillers that are tired of going in every 6 months for fillers, they can come in, get the fat transfer, and if the fat transfer takes, you're done. And you can also inject the lips with it, the cheekbones, what we call the nasolabial fold, which are the lines on the side of the nose that extend down to the mouth.
I feel like
So-
you're looking at my face.
Well, you asked me to evaluate you, didn't you? You said, what can I do?
I did.
So-
Off the air, I did say. Because
Yeah.
let me ask, like, if I wanted to go
Sure.
to you and just have a consultation,
Yeah.
would I be able to do that where you can tell me, like, okay, well, we can do this and we can do that, or what you would recommend? Because do you find that you do have patients that get a little crazy? Like, they come in there, they want to do everything.
Well, yes, I do feel that we do have patients that I think are a little bit too on the extreme side, but I kind of feel that's the responsibility of the plastic surgeon.
Right.
To set
Give them what they want.
Well, yes and no, because you want to set expectations with that patient too. If someone comes in and says to me, I want to go this size with an implant, my job is to say, okay, your frame can accommodate that, or it can't. For instance, I just had a female come in a couple weeks ago. We did a lip filler for her. She looked great. She came back in a couple weeks later, wanted to go bigger, and I was trying to tell her that it's going to look ridiculous on you.
Right.
It's too much. So I do feel that's the doctor's obligation to at least educate the patient on the reason why or why not you're going to do something.
Right.
And
I love that, because you want to be real about it, because, you
For sure.
you could be that plastic surgeon that just wants money, money, money. But if you're
Right.
going to tell your patients, look, this is as big as you can go with this without
Right.
it looking funny.
Right.
Or
Well,
normal.
That's part of it. And like I tell patients all the time that I don't think they're candidates yet. For instance, another example is tummy tucks. We
Right.
use something called a BMI, which stands for body mass index. So we will not do a tummy tuck on patients that are above a certain BMI. Now, the reason for that is
Okay.
A, is safety.
Right.
But the other reason is I tell patients, I don't want to take your money and I can't give you the results that you're looking for.
Right. You'll be
So
back again.
You'll be, and you're not going to be happy. So for me, I always pride myself on I want my patients happy. And sometimes you have to have that hard conversation with that patient and say, I'm sorry, I can't do it. I had a woman cry in my office about a month ago. Her BMI was 48. Now, 48 BMI basically means that half of your body weight is fat.
Oh, wow.
And I told her, I said, listen, I'll do your surgery, but you got to prove to me that you really want it.
Right. Don't you, when you're getting like a knee replacement or you're getting something done,
Yes.
Usually the doctors will say, well, you need to be at a certain weight because,
Exactly.
we can't, it's not going to fix anything. You're going to have knee problems if you don't lose the weight.
Right, 100%. Same thing is true of here. Not only that, taking a patient with that high of a BMI, subjecting them to anesthesia for a good 4 hours, 5 hours,
Right.
you increase that patient's risk of complications in the operating room as well.
That's
So
true.
that's what I meant when I said, it's the doctor's obligation to educate the patient on why or why not we're going to be doing a particular procedure. That's an example. In my opinion, you should not be touching that patient until they get their BMI down to low 30s.
Right. Okay. That's very educational for me, because I
Yeah.
wasn't sure. I'm thinking anybody can come in there. Because what age group do you usually? Is there like an age or?
No, not really. It depends on the procedure because
Right, that's true.
Like I said, my youngest patient I've ever operated on was probably 30 minutes old. Unfortunately, they had
Jeez.
the patient, mom had a C-section, and in the process of removing the baby,
Right.
the OBGYN doctor inadvertently cut the side of the patient's face. So they called,
Oh, my
yeah, so
gosh.
they called me in right away to repair this poor kid's face. Everything was fine. The kid did fine. My oldest patient, probably up in the upper 90s, someone that maybe had a slip and fall, split their forehead open, and
Right.
they called me to repair that. The majority of my cosmetic patients, however, you're probably talking somewhere between 18 years old for breast augmentation up to in the 50s. My facelift patients are more in the range of 45 up to 80
Okay.
is probably for my facelift patients and eyelid surgeries.
Eyelid surgery.
Mm-hmm.
Okay. When I look at pictures of when I was younger, I don't know if that's that collagen or your face is so much
Right.
fuller when you're younger and you don't see the wrinkles as much.
Right.
So as you get older, do you feel like our faces get kind of drawn?
Well, that's exactly what happens.
Is that what happens?
Yeah, what happens is we age. We all lose that that connective tissue that we once had that's nice and firm, and we lose elasticity as we age. And when you lose
Okay, that's the word.
elasticity,
Yes.
the skin begins to hang. But besides that, the muscles of the face also get lax. And that's why someone will come in to have a facelift because they're noticing these jowls. So the muscles of the
Right.
face get lax, move south, it pulls the overlying skin with it. You also lose volume as we age, and the bone actually reabsorbs as well. So our bones over the years begin to decrease as well. So that's the reason why sometimes we have to put fat back in to restore that volume you once had. A lot of times when I have a patient come in for a facelift, I'll ask them to grab a picture of themselves when they were in their 20s and 30s, just so I can see exactly what they look
Right.
like. Because I'm only seeing them for the first time when they may be 70.
Exactly.
So it's nice to have that picture to look at them when they were younger. So when I'm in the operating room, I could try and get them as close to that as possible with fat injections at the same time as a facelift.
Right, and I don't know. I mean, I'm not the expert you are, but if I would come in for a facelift, but my neck had all these, wrinkles, and
Yes.
because a lot of people say you can tell somebody's age by their hands and their neck.
Correct.
Is it men and women?
Yes, both
Okay.
of us. So men and women. So yes, you are correct. A facelift will improve the appearance of the neck, and that's part of the reason why when I do a facelift, my job is to educate them. Sometimes we may have to add other things with that. So for instance, if there's a lot of sun damage to the neck area, I may want to chemical peel it at the same time as a facelift to get rid of some of the sun damaged skin.
That. Yeah.
Or we have lasers in the office. We can resurface the skin as well to help also with the sun damage. Same for the back of the hands. Now, the back of the hands is interesting because you can use fillers in the back of the hands to restore volume.
Okay.
Yep. And you could also use fat in the back of the hands to restore that more youthful appearance, along with doing something if there's a lot of sun damage. So, again, chemical peels or laser resurfacing.
Right. And the way I was raised, we used baby oil. So the sun damage that I have, and like you'll see, like some people get blotches on their face, or they get what are those little brown spots?
Yeah, so they're what they call, they're called actinic keratosis, which is basically sun damaged skin. All right. So, and unfortunately, when I talk to a patient, I do skin cancer also. When I talk to a patient, I tell them it's a cumulative effect. So, of the time you're a little kid up until the present age, it all counts.
Oh, right.
And it takes years to decades for some of that sun damage you did in your 20s and 30s to manifest. So, so when someone comes in, I tell them with those type of brown spots, they are technically considered precancerous. I don't really do anything with them unless they begin to transform and change. If they change, then yes, then we have to do a biopsy and we have to cut it out. If someone doesn't like the appearance of it, we can still get rid of it. Right. Again, we have different modalities that we can treat that with.
I try to camouflage mine with, putting on some bronzer and some, but I know I have some down here and I just haven't really got, then I got the red lines in my nose and I just use makeup to cover it, but it's not like it's going to ever go away unless you do something about it.
Correct. Well, that's one benefit of being a female, right? You can use different creams. Most men, we don't put makeup on.
Do you see a lot of men?
Yeah, we're seeing a lot more men now coming in, and I think it's because their significant others pushing them in or dragging them in with them. So I'm doing a lot more Botox on men these days. Yeah. And I'm doing a lot more liposuction of the patients for the midsection, especially guys. And then, believe it or not, we're seeing a little uptick in tummy tucks on men as well.
No way.
Yeah, it's still predominantly, though, a female-dominated industry. There's no question about it. But we are seeing that uptick. And we'll have husband and wives come in together, both for Botox.
Is there a special?
Oh, yeah. We do specials for that, too. We do specials for weddings, too. We try and do that as well. We give, free Botox to the bride if she brings the whole party in with her.
Oh, my. That is. Tell us about your meds. It is called?
It's called Oser Plastic Surgery and Med Spa.
Med Spa.
Okay. Yeah, and like I said, we're located up in the Robinson area. If you know where IKEA is, we're literally 3 buildings down. There's a big building there. It says Heritage Valley Health System. Okay. So we're right in there on the first floor. So the Med Spa, we do all the injectables there. So Botox, all the fillers. Okay. We do chemical peels. We do eyebrow tinning. We do permanent tattoo. I don't do the permanent tattoo or anything. I have an esthetician who does that stuff.
Okay.
We have laser resurfacing. We have facials you can get done there as well.
Laser resurface. What do you mean by that?
Yeah, so we have a laser that does everything from laser hair removal. So if you have excess hair in any particular part of the body.
I'm Italian. I got it. Okay.
Yeah, I get it. So we can remove that excess hair for you. Also, if you don't like the texture of your skin, we can resurface it, make it smoother. We can
really?
Yeah, we can get rid of some of the fine lines and wrinkles. We can decrease the size of the pores on your face or anywhere else in the body for that matter.
Okay.
So the laser does that. Also, you mentioned just a couple minutes ago, you have those little fine red lines around the side of the nose. So those are called telangiectasias. They're very small little vessels. The lasers are effective at reducing those red veins as well in that area, as well as lower extremities. We have a lot of women who'll come in, don't like the little
varicose veins.
Yeah, well, the varicose veins is a separate animal.
Okay,
that's more of a vascular surgeon type of thing.
Right.
But the small little, what we call spider veins.
Spider
veins we can accommodate in our practice with the same laser that we have.
You always wonder why you get them. Like, is it hereditary or?
Well, there's multiple reasons. Hereditary is definitely a factor. The other thing is occupation. So someone that's on their feet all day are more prone.
Right.
Weight also. So someone that's carrying around a lot of weight, and pregnancy counts as putting on additional weight. That also can cause increased spider veins as well.
Okay, yeah. Mm-hmm. I mean, so you said you do the aesthetic side, and then
we have other people that do some of the esthetician stuff.
Okay.
So the esthetician, she has her own hours and she does her own thing. I still do a lot of the injectables, so the Botox, the fillers, and fillers we could do anywhere in the face. So forehead, believe it or not, how people come in, they don't like some of the little lines there, we'll inject them. The temporal areas on the side, as we age, that gets hollowed, so we can definitely put some filler in there. But the common areas are cheekbones, lips, what we call the nasolabial fold, and marionette lines. And those same areas I just mentioned to you, we now can offer fat in addition to just the fillers. But if someone's just trying to improve their appearance, it's the first introduction they've had to a plastic surgeon, I usually recommend just doing the injectables first because they're temporary.
I do the forehead. I just started doing the forehead.
Yeah, and then like
the 11s.
The 11s, so the common areas for Botox is the 11s, which is the area between the eyebrows. The forehead's a second big area, and a third big area is what we call the crow's feet on the side of the eyes. Botox is awesome. I love it. I've been injecting myself for a good 13 years.
I mean, I'm looking at you and I'm thinking, but everything's moving. Like your eyes are moving.
Well,
you know, some people say you look like you're not even like laughing or mad or. You know.
Right. Well, thank you. Well, although some people I'm sure would want to inject my lips so I don't talk anymore. But so like, you know, there's a misconception too between Botox and fillers. Like I can't tell you, people are still coming in and saying, I want Botox, and they'll point to like their lips or the side of the nose where that depression is. I'm like, that's not Botox, that's a filler.
So to fill up that line.
Right, to restore volume that is lost over time.
Right.
Botox does not give us volume at all. Botox prevents movement in the face. So I'll use it in the forehead, the crow's feet, the 11 lines to stop movement. And the thought process there is that by not using those muscles, and unfortunately with Botox, it only lasts 3 months. I wish it would last 6. There is a new product on the market that's coming out very shortly. They just got FDA approval that the claim is that it lasts 6 months. I don't know yet. Time will tell. No one's injected it yet.
Right.
But Botox is great for those areas I just mentioned. There's a lot of other areas you can use Botox too. Like we'll inject women and men in the armpits to stop sweating.
Oh,
now the nice thing there is it lasts 6 months.
What are you doing? Is it going into the pores or something?
Yes, I inject it same exact injection technique as you would do for the forehead. We inject in this what I call the subcutaneous plane, which is the fatty layer. You inject the Botox in there, and then what happens is it stops the patients from sweating because sweating is caused from what we call a sympathetic response. So it blocks those receptors so that basically the signal never gets to where it has to get to. The analogy I like to use in my patients is if you ever had kids, you know, you have those little plastic plug-ins you put into the wall outlet so the kid can't stick his finger in there.
Right.
That's exactly what Botox does. It binds to the receptor and doesn't allow that signal to ever make contact. So it never sends the signal. So in the forehead, it never sends the signal, and you're unable to have a facial movement in that area.
So do you sweat out somewhere else?
Good question. I mean, you're still going to sweat from other areas. I mean, we still sweat from the palms of our hands, the feet, and between the legs and stuff like that. So you still will sweat. But a lot of women will come in to get this done in the spring, so it lasts us throughout the summer. And some patients really do have a problem with sweating to the point where it's extremely embarrassing. They sweat through their clothes. So it has been like pretty much like a wonder drug as far as that's concerned.
That's fascinating. Now, let me ask you this.
Sure.
Are you certified? Like, what is your background?
So my credentials are, I'm a board-certified plastic surgeon. I did training first in general surgery for 5 years. I trained in Detroit at a place called Henry Ford Health System. And I did 5 years of general surgery, got board-certified in that. And then I went on to specialize in plastic and reconstruction, which is an additional 2 years. All right. So, you know, people ask, what does it mean to be board-certified plastics? Because there is a misconception out there of what a plastic surgeon is, what a cosmetic surgeon is, because nowadays, to your point, you see a lot of people injecting Botox. I mean, I know some dentists that are injecting. I know OBGYN doctors.
Yeah, you can go to your dermatologist and they...
Yeah. So, I mean, so we had training specifically in those areas, okay? So, you know, cosmetic surgeons, totally different type of residency than what I did.
Okay.
Right? So we also specialize in that. Plastic surgeons, you can operate anywhere. You can operate any health system. You have privileges anywhere. the health systems won't allow these other doctors to come perform procedures there because it's a totally different credentialing process. There's only two approved organizations that certify plastic surgeons. One is the AMA, the American Medical Association, and the other one is the American Osteopathic Association. So there are no other organizations that are out there verifying doctors to do plastic surgery.
If I looked, I was going to say Yellow Pages. Wow, I'm dating myself.
Right.
If I Googled, looking for a plastic surgeon,
right.
I need to look for these kind of credentials.
100%. So you got to ask your doctor, and you can't just say, here's the other problem I have. I do a lot of revisionary work for patients that went elsewhere, weren't happy, and they'll come in and they'll say, well, I didn't look up my doctor beforehand. I should have. So like, you do know he was just a family doctor, and then he did like this weekend course on how to do something.
Oh, no.
Well, the trick is, I shouldn't say trick, what you need to really ask your doctor is, when you say to a doctor, are you board certified? And they say yes. They're not really telling you what they were board certified in.
Exactly.
You have to then follow that question up with another one. Say, are you board certified in plastic surgery specifically?
Right.
Okay, because that's what you want to hear. And if they say, no, I'm board certified in ER.
Oh,
well, then
there's
it's up
a
to you.
difference, yeah.
Well, to be fair, I mean, there are some cosmetic surgeons out there that do very nice work.
Right.
I know some of them personally, and they do nice work too. And over time they learn. But so that's the real difference. It's the training. We also have training in reconstruction, which I really feel one helps the other one. So when you're putting someone's face back together, and we had courses just in facial anatomy, where we learn all this stuff. We did craniofacial reconstruction as part of our training. It's something you don't get anywhere else.
Right.
So, you got to put all that into perspective. And then, any doc you're going to be interviewing, you should ask to see pictures of their work. I think that's a fair question. Other questions is, if complications with a particular procedure, any deaths from that procedure you're thinking of having done, because in my opinion, those are all very fair questions to ask your doctor. I also pride myself on giving all of my patients my personal cell phone number at the time of their procedure. So everyone that has a cosmetic procedure done by me, it's on my discharge instructions. They know they can call me any time of day, around the clock. They can text me. Yeah, now with the advent of social media, the way it is, people can take a picture of something and
like, hey, I think I'm swollen on this side. Does this look normal?
Right. Or is this drain output normal? Does this color look normal? It's very simple. We have a lot of patients fly in from out of state. So a lot of them.
So you're reputable. Like, you have a very good reputation.
Oh, I've operated on people from the Middle East, from Africa already.
No way.
Oh yeah, that have flown in for surgery, and we put them up at a hotel that's not far from my office, and they have to stay in town for about 5 days. I personally will go out and see them. A lot of places you just have like a recovery room nurse that may see them. You never see the doctor again. So that's one thing I always want my patients to realize when they come see me and I do their surgery. You get me every time.
Right. They want a relationship. They want to be 100%. Able to feel secure and that they know you're going to be there the whole time.
100%. It's like that little something extra because, people are paying money out of pocket for these procedures. And I think patients really demand that nowadays.
I was going to ask you that no insurance really covers plastic surgery.
Well, it depends what your definition of plastic surgery. Cosmetic stuff, no. They do not cover it. It's all out of pocket. Yeah. The other stuff, yes, like I was mentioning, like I do, like the trauma patients, yes, breast cancer patients, yes, you can get covered. Skin cancer, we can get covered. Some breast reductions, we in my practice have stopped doing breast reductions for insurance purposes. We'll still do them, but we just don't. It's an out-of-pocket expense.
Because I've noticed too, like if your eyelid, like as you get older, it starts like you can't really look out of your eye. I wonder if that would be considered.
For the upper eyelids, yes. So basically what you're talking about is as we age, there's skin on the upper eyelid that begins to hang down. If the skin hangs too low, it can actually obstruct your visual field.
Right.
We have you go see your eye doctor first. They do this study. It's called the visual field study. If you fail it, send it over to our practice. We'll then submit it to your insurance company, and the majority of the times we can get that covered for you.
Okay, that's wonderful. I mean, tell us a little bit about the videos, because I know off air we were looking at some videos, and at first I was like, I can't look, and then I was like, wait a minute, I'm kind of intrigued by this. I want to see what's going on.
Yeah, so I like to videotape my surgeries, and I give a copy to the patient if they want it. I always, on all my patients, will take before pictures, and then I take after pictures. But in conjunction with that, I can also shoot some video. So a lot of patients, for instance, when I'm doing a tummy tuck, they like to see their muscle separation. They want to see me throw those stitches in that muscle.
I couldn't even watch myself having a baby, so I don't know if I can.
Well, it's like I tell everyone, anything in time becomes second nature. Right. Like the first time I saw it as a resident, I'm like, wow, I can't believe this is happening. And then a couple more, you're like, all right, it's second nature now.
Exactly.
So, I do an average 4 to 6 lipo tummy tucks a week, which is a very high volume tummy tuck practice. We do a ton of breast hogs too. But I do find that by videotaping some of these procedures, I help educate other patients that are sitting home and contemplating having it done. And I try and pull videos up to match that patient's body habit. So if someone comes in that's like 5'6" with an A cup and they went to a C cup, for instance, I'll show them videos on the same type of body habits.
Exactly.
Because I have enough videos and everything. And then a lot of times we'll post them up on Snapchat or we'll put stuff up on Instagram just to help educate the public. And that's how people kind of find me too.
I like that. That's very different because I don't think there's any plastic surgeons out there that would offer like a video to just really educate, your patients or people that are in the market to do something different.
Well, they say picture's worth 1,000 words. So even when they come in to do that initial consultation,
I like that. That might be the title.
There you go. Well, I always.
Who is this up here?
So that is a little video of me doing a FaceTime with someone. These are some videos of some extreme cases. That's my board certification you just saw pop up. This is someone that lost a large amount of weight, one of those post-bariatric body contouring procedures.
So this is the before and this is the before and that's the after. Okay.
Well, I'm not done yet. I just stapled the skin, and there we take all the skin out you saw, and then we have to stitch everything back together.
Is there a scar though, like a really big?
Yes, there is a scar. So I tell patients it's a trade-off. Everything in life is a trade-off. Now, one thing that we do in plastic surgery is we try and minimize the scars as best as possible.
Right, because then you have that end of it too.
Right. So I use sutures that are not as reactive. We try and do different things to help reduce the amount of scarring. We like to place the scars in areas that may be hidden. Right.
That's true.
So that's something they teach us also as part of our training. How do you cut? Where do you put the scar placement?
So you're taking it out.
So we take that excess skin out. Same concept we do in the arms as well. Right.
Listeners, I don't know. Like if you're watching this video of us doing this podcast, you can see the pictures up here. But if you're listening, I mean, it's interesting.
Yeah. And then there's a quick before and after. So that's someone that lost 200.
Wow. Oh my gosh.
225-pound weight loss she had. And that's with liposuctioning along with cutting the skin out and suturing everything out.
Wow, that's unbelievable.
Yeah, so I mean, these are really life-changing procedures for these patients because there's no way that skin is coming out any other way.
Right, yeah, you can exercise, every day 24/7.
Doesn't matter, and that patient actually does. She does it fine. Yes. This is someone we did a full facelift on.
She looks beautiful.
Yeah, there she is a couple months after her surgery.
Oh, wow.
Yep. So she looks really good. We did her lower eyelids too, and there's the after effect of lower eyelids as well. Okay.
Oh my gosh, I bet the patients when they walk out of your office, they're just so excited and happy, and like you said, the confidence that you have.
Right. And this is a BBL right here, and you can see how we got rid of the fat around the bra line area, the waist. We contour that in. We put some fat in what we call the hip dip area here, and we gave her more projection. I know it's hard to tell here, but we did.
I can tell, yeah.
But everything looks smooth now. It looks like natural.
Oh, yeah.
This is someone that's out a good 3 months. You can see the hip dips here are gone. The waist, the love handlers are gone. She has a nice contour. The bra line fat is gone, too.
See, I have a short waist, so I'm, like, looking at that like, man.
Now, this is just a quick little in-office procedure we do while you're awake.
Okay.
We did submental liposuction. So you can see this little redundant area here that bothered her. She didn't have a defined jawline. Now she does. Now that will even get better. That is immediately post-op right there.
Oh my gosh.
Yeah. So, and here's another one. Same thing. That's a little stitch we put in the submental. These are some before and after post-op, so you can see some big body.
The tummy tucks, yeah, I was going to say, because look at how distorted the belly button looks, especially when we have, some women have children. Their belly button doesn't look right anymore.
Right. Yeah, no, exactly. So that's something you got to think about, too. The other thing is scar placement, too. But this is the same patient. You see how she has an hourglass figure now. That's immediately post-op. I know you're looking at the incisions, and that's long. You do have to have a little drain. That's the drain right there. It's typically in for like 2 to 3 weeks after the surgery.
That's unbelievable.
But she has a belly button you can see now. She has a waist now you can see. She has a nice hourglass figure. That only gets better with time, too.
Right. And a lot of women or men would want to do this before, like, the summer comes.
Yeah, and like here's something that's been out a couple months. Now, if you notice in this picture, we always like to hide the scar. So what I'll tell patients to do a lot of times is the day of their surgery, I say, bring a pair of your bathing suit bottoms that you typically wear. I'll mark the top and the bottom of their bathing suit or underwear, and we make sure the incision's contained right within that area.
Oh,
so when you look at her
nice.
post-op, you can't even see where the
Not
scar
at
is.
all, no.
Yeah, and then I like to do a little bit of ab etching where I go a little more aggressive with the liposuction from the belly
Yes.
button up to the breastbone.
Oh,
there.
she got her breast done too?
Yeah, she got her breast done too, but at a different time.
Reduction?
Reduction lift. we
Lift,
did on her.
reduction lift. Okay.
Yeah, reduction lift.
Could like it, for instance, I always say, oh, I want to get a lift. Can I just go in for a lift, or do you have to do like make
Yeah.
them smaller and then lift them? Or
So it depends on what your starting point is. So what I try and tell patients is, here's an AUG lift. This woman
Oh,
lost
wow.
a large amount of weight, and there's no way those nipples are getting elevated like they are here.
Right.
She doesn't have cleavage, as you can see in the top. She wanted that. So this patient, she needed volume. We had to give her back. So she does have an implant in. Yes, there's the scar. This film you see around there, that's glue that I use. The glue comes off, and it actually heals really nice.
Nice.
But from that to that is night and day. We shrink the areolar size down.
Right.
But to answer your question, you don't always have to have an implant. So if you were someone, let's say, as a D cup, and
Right.
you come in, you want to lift, what I'll tell patients is when we do the lift, you naturally will get a little bit smaller. So if you're okay going from like a D cup maybe to a
Oh,
full
yeah.
C, then we don't have to use an implant.
Right, because I think, with my body type, I mean, I'm like top heavy, and,
Mm-hmm.
and I have like a really small waist. So when I wear clothes, I just look like a box. Like I look like a box.
Right, and this isn't. There's another patient had an AUG lift. You can see how
Okay.
nice. Now she wanted to go to a nice full D cup. This patient.
Oh, yeah.
You could see the same bathing suit she shot for us. How flat she is here. No cleavage here. No upper pole fullness here, and there
Right.
she has it. So
Oh, they look nice. Yeah.
Yeah,
They
yeah.
fit the bathing suit nice. And I mean,
right. So that's the other thing about like these procedures.
fitting clothes. Right.
Like a patient like this will come in and say, I can't wear certain type of tops. I can't wear certain bathing
Right.
suits. They just
feel
feel
like-
embarrassed.
Yeah.
So those are all things
I
that
love
we try
this.
to. Yeah, thanks.
So
thanks.
we can, is there a website that we can get in contact?
Absolutely.
Or
Yeah, so you can just go to my website. It's just my name. It's Dr. Oser. So it's DROSER.com. And I also have like a vanity telephone number. It's 844 for Dr. Oser. So you can
Oh,
go
okay.
there as well and just call us. We can work whatever is most easy for the patients. So we do a lot of virtual consults. So even though you may be local here in the Pittsburgh market, you may
Right.
say, well, do I really have to come to the office? You don't.
right, or somebody out of state.
Yeah, right. So we could do it just through FaceTime. We do FaceTime videos. We have you fill out the paperwork, you submit pictures, and then we'll get you set up for a time that works best for that patient. So I try and accommodate everyone. So I'll do like evenings, and also on a Sunday, I'll sit down and we'll do virtual consults.
Oh, that's great.
Yeah, so we try and accommodate however you want. Here's our website. You can see right here.
Nice.
And you just hit request an appointment right there.
Okay.
You specify which one, the virtual appointment or in office. We just ask you some basic demographics, what you're coming in for, your name, your address, your telephone number.
Oh, that's
I do not
perfect.
charge for my consultations.
I was going to ask you that.
No, I do all free consultations for all my patients.
I'm going to get mine after this.
Oh, there you go. We'll do one.
podcast.
We'll do one in the next room for you. So yeah, and then if this is something that you really want to move forward with, we also have financing available for patients because we do realize some of these
Yeah,
these
right.
patients request.
It's hard to afford it, a
It's
lump
all-
sum.
especially when you're combining procedures like a
Right.
mommy makeover. We may be doing a liposuction, tummy tuck, and breast lift at the same time.
Right.
It can be costly. So we accept different types of credit cards. Of course, we always accept cash and check. And we also have finance companies. There's one called Care Credit. We have another one
Oh,
called
yes, I've heard of
Alpheon.
it.
And they basically will finance the procedure for you.
Right.
Yeah.
So you're paying like monthly or
Correct. So
Okay.
you pick the program. So we have 12-month repayment, 6-month repayment, 2-year, 3-year repayment plan. So whatever works best within your budget, we'll accommodate.
I love that you're so accommodating. I
Yeah.
learned so much about
Oh, well,
plastic
awesome.
surgery.
Yeah.
I really appreciate you
Well,
being
my pleasure.
on.
We only touch the surface,
Right.
believe it or not. Each one of those topics, we can have another discussion, or maybe
Yes.
we'll do that another day.
Exactly. I think that a lot of people are scared. Well, I shouldn't be saying a lot of people. I know for me that I was always scared that I can't do this. It's going to happen to me. I'm going to be that one that's going to be distorted.
Right.
So I think by talking to you and seeing all the different pictures, I mean, it's unbelievable.
Well, thank you. But the other thing is, like, it's my job to walk you through that process.
Exactly.
Like I tell everyone, this what you're feeling is normal.
Right.
All right. I do this every day. You do this once in a lifetime. So
Right.
it's my job to walk you through that process, get you across that finish line, and also make sure I'm there for you afterwards during your recovery phase
Right.
too.
And you really made me feel at ease and comfortable too by
thanks.
talking
Well,
about
thanks.
this.
I
And
try.
And even looking at the pictures, I was like, okay, I can do this. I can do
well,
this.
good. Well,
So
good.
I appreciate you being on Spill With Me,
Likewise, it was a
Jenny
pleasure.
D.
Love to come back again, talk again soon.
Definitely,
All right.
definitely. Thank you so much.
Perfect.
Thank you
You're
for
welcome.
being here.
Thank you.